I want to introduce to you Peter Murphy. He is the outreach manager for the Mental Health Association of San Francisco. And many months ago, they had reached out to us because of funding issues. And we did support a letter to reinstate funding into the state budget. The state decided to reinstate some of it, but they didn't reinstate all of it. And I'll let Peter explain to you what that means. But really appreciate the work you do with the California WarmLine, and that you're on a mental or behavioral health commission as well. So I'll let you get started.
Okay, thanks very much. Yes, I'm Peter Murphy. I'm with the Mental Health Association of San Francisco, like Teresa mentioned. I'm the outreach manager. I've been at the agency about 10 years, so I was actually on the WarmLine when I started here about 10 years ago. And I was on the WarmLine for about 5 years as a counselor and as a supervisor. So I have very direct experience with the service itself. And I want to thank Teresa for inviting us and for all of you joining for this presentation. Yeah, Teresa's just been great, very supportive, and I really appreciate it. So I've got some slides I'm going to put up, and I think it was great that we had time for questions. So I'm going to try to be sure that we have a good amount of time as well. But I'll leave my my information too. So I want to give you some background about the WarmLine, and I don't want to assume, I guess, that everyone is familiar, but I'm hoping some of you are familiar. I know there's some Shasta County folks on this call, and Kaylin Jones, who is on the Behavioral Health Commission in Shasta County, was actually a manager on our WarmLine. So hopefully you're all familiar with it for sure. So we've been state funded for the last 6 years, and that allowed us to provide a 24/7, 365 day a year service. And there's a lot of folks that get confused about what a WarmLine is as opposed to 988. And I know in some parts of the country, WarmLines have been ended because folks figure, well, we've got 988, but really we provide a different service. I mean, the WarmLine is, we see ourselves as pre-crisis and trying to keep folks out of crisis. I think some of the biggest work that we do is really normalizing conversations about mental health. As a counselor myself, I mean, I identify as someone, I identify as an alcoholic and an addict. I've been clean and sober for quite a while, but I did not, and I got clean and sober through 12-step recovery, but I didn't really find the same support around my mental health until recently. And I feel like what we offer in peer recovery is similar to 12-step recovery in the sense that it's sharing our lived experience. So, for me, it's been invaluable. So yeah, I'm happy to talk about it here today. So we've had a Spanish language WarmLine, which now, because of the funding cuts that Teresa mentioned, we've had to eliminate these services right now for the moment. And we're trying to, as we go through this talk, we'll talk more about where we're at with the funding. But we were set up to offer the services in Spanish with bilingual counselors, and we're really proud of that. But unfortunately, yeah, that's had to have been cut for now. So. There's also what we call the WarmLine Federation. So, and these we started receiving California state funding in 2019, and then again in 2022 it was increased. The funding was, which allowed us to start what we were calling the WarmLine Federation. So, if you're familiar at all with WarmLines, they tend to be to vary a lot, and having this federation allowed us to provide more consistent service and to work with smaller warm lines around the state. These are some of them. I'm not sure how well you can see this, but I'll just mention a couple of them. So the Mental Health Association for Chinese Communities was one of our partners. They're based out of the Bay Area, and so it was really easy for us to partner with them. But they primarily serve California, but they serve the whole United States, and actually, and they have Cantonese, Mandarin, and English speakers. There's also the CALHOPE Red Line, which is still going strong. They received some funding from the state this last funding go around as well. There's also the Ukraine Liberty Fund and Hug Space, it's called. So that's for Ukrainian refugees. They provide all of these provide their own counselors. We were able to, when our funding was robust enough, to provide funding to help with training and hiring and so forth. And we had regular meetings of the members of this federation. There were I think ultimately about 10 groups from around the state, and yeah, with the idea of systematizing the services that are provided by WarmLine. So let's see. So, and this is a summary of impact since 2019. Whoops. So, so we were able to connect with over 700,000 contacts during the 6 years that we've been in operation, and our service, it was becoming more it was being used more and more as time went on. I mean, our biggest month ever was May of 2025, so just a few months ago before the end of the fiscal year. We received over 41,000 attempts at contact. And I say attempts because even when we were at capacity, we weren't able to get to all the calls, and we're calls and texting and also online chatting. So when we asked for funding this last funding cycle, we were asking for more funding in order to meet the greater demand, but the state has been at a deficit, and so yeah, that didn't work out. But we've been busier than ever. We also I think some of that, we saw a spike in calls after the last presidential election and into the new year, and then also with the California wildfires. I mean, we are serving the entire state, which allows us to really provide services also for like kind of remote areas, rural areas that may not have access to as many mental health resources. And I feel like in a little bit, in a way, I'm kind of, what's that expression? Preaching to the choir, but I want to give you some background. And the WarmLine, we are still in operation. We've just been really like cut back, drastically, which we'll talk about in a few minutes too. So this is some of this chart gives information about some of why we feel like the WarmLine is special, and some of that is about the peer aspect of it, which I mentioned. I mean, all of our counselors and staff are identified as peers with mental health issues. So that means that we like to say we've been there, and that's what we can share with the folks calling in. And it's really kind of a community. I mean, I know when I was on the phones, I would learn things from the callers as well, like maybe about resources I wasn't familiar with, and so forth. So it's not hierarchical really. It's really like it's very the idea of a peer model is that we're all in many ways on the same plane. What I tell people is I've just been doing this longer, I guess, than a lot of folks. I mean, but not all, but anyway, that we help each other. So we also want to highlight that we are a cost-saving measure. We've done surveys with our callers that indicate if like up to 15% of our callers might seek costly ER services without the WarmLine support. The questions are like, what would you have done if you hadn't called in today? And sometimes it's you call the police, call 911, maybe hurt myself, go to the ER, call my psychiatrist. And these are all outcomes that we're trying to, that in the long run, we're either trying to prevent someone from hurting themselves, of course, or uh, where a situation escalates to where they need more expensive services as well. So with this idea of 15% of callers, that's around 14,400 visits per year and a potential savings of $93.6 million, just in ER savings alone. So, there's information that this is about budgeting, which I think I'm going to skip through in the interest of time. But there's information that like $1 of prevention can save us $5 to $6 in terms of care later on. And I feel like I've really witnessed that with the warm line. I mean, many of our callers, one of our biggest jobs is really to sort of de-escalate things. And we have a strong relationship. I mentioned 988. We have a strong relationship with them. I mean, we have what we call a warm handoff, where if somebody is at a high risk of suicidality, we can transfer them directly to 988, with the idea that we have an area of specialization where we work, and then they transfer folks to us, based on, like, they triage calls as well as are doing that. So we work in tandem. So this is about the current budget. So we ended up receiving what amounted to less than $5 million a year. The last go round in 2022 of funding, we were getting around 14 million a year. So it's about a third of what we had become accustomed to. The CalHOPE Red Line also received some of that money. So we ended up with, I think it's around 4.2, 4.3 million a year. So we've had to make dramatic cuts. We laid off close to 200 counselors and employees from the agency. So you can imagine that has dramatically reduced our services. I'll talk more about that in a second. So yeah, as I mentioned, we lost the Spanish language warm line, 75% of our warm line staff, loss of capacity to provide services, severe cuts to hours and support. So we had been 24/7. Now we've gone to, it amounts to about 40 hours a week, I believe. Maybe actually somewhat more. We started 7. Yeah, actually it is a bit more but it's 5 days a week, from 7 a.m. to 11 p.m. And then on Thursdays it's a few hours less for some administrative meetings that we have. We're keeping the federation going, but we cannot no longer offer the funding that we were able to provide for the federation partners. But we are going to continue meeting and sharing information, and hopefully we'll be able to return to the services we were able to offer before. So again, this is a little bit about the hidden costs of losing the warm line. The idea that it's really hard to quantify, to say how much to say in terms of the monetary value. But I mean, we do have that information about the ER visits that we mentioned, and overall, we're pre-crisis. Like we really want to emphasize that, and we're trying to keep. It doesn't mean we get crisis calls still. I mean, the callers don't necessarily know, but I feel like our training is really excellent, and it allows us to prepare our counselors to assist whatever situation is presented to them on the phones or texting and so forth. So this is that note about $1 prevention saves us $5 later in terms of ultimate funding. And yeah, we had been facing a growing demand, and now we're not able to keep up with the demand we do have. So we're trying to ensure a long-term impact. I mean, we still have some staff. I mean, we still are answering the calls. Like I mentioned, it's a little over 40 hours a week. We I think the pandemic demonstrated to us the need for services like this, and we are hoping that yeah, we can resume our services and to continue to provide the quality and the quantity that's necessary. And we do want to thank the governor, the assembly, and the Senate. We made a great effort. We had support in the legislative side, but ultimately we were not able to get the funding we were hoping for. So, but Teresa's helping us by allowing us to visit today with you all. And one thing we are hoping to talk about is Behavioral Health Services Act funding, maybe at the county level. And so we're in the process of making plans around that. And, we may be in touch with you and your county soon. So thanks, Teresa. And I guess if we have time for questions.
Okay, yeah, thanks. We have time for questions. If anybody has a question online, raise your hand. In the room, we have, go ahead, Christine.
So first of all, thank you for your service. I think this is a great service, and I'm sorry to hear about your cuts in funding, because clearly it's something that we really need. And my questions, I guess, were a little bit more related to probably since you lost this funding, but you were talking about the number of attempts per month. And I was wondering a couple of things. What percent of attempts were you able to service? And secondly, do you have any data that shows that if someone made an attempt and was unable to connect, do they make successive attempts to get through?
Well, that's a really great question. We were very fortunate. I mean, we had some folks really focusing on our data. We're not really able to afford that as much now, but we have a lot of information prior to the funding changes. And the actual connections, it kind of varied depending on our capacity. We had such a big staff. There was always like there was turnover. And we were nearly always hiring, it felt like, but when we were doing well, we were getting to like 3/4 to say 80% of the calls and attempts at contact. And when we were having more trouble, and if we were lower on staff, it would drop to about 50 to 60%. We did have folks leave messages and all that, and then we could return calls, if they wanted. But we were trying to pick up calls, when the person was calling in straight away. And really, I think after that, there wasn't any way for us to track like their successive attempts, But that's a great question. And I feel like it was great. We do have a lot of data, which, pretty soon is going to seem obsolete, I guess, but it's still a snapshot of a picture in time of what we were able to offer. We had been just growing by leaps and bounds, I mean, I think since the pandemic, I think really demonstrated, I mean, suddenly everyone was isolated, right? And isolation is a super concern of folks calling in. We get a lot of folks, it's like, oh, I'm looking for work, I'm having trouble in school or relationships, and I'm isolated, okay? So, and we're kind of a gateway, people call in and, I've never talked to anybody about mental health, and we can start those conversations in a very safe, low barrier kind of way.